Go to our first phone call. Alan, who's in Olney, Illinois, Democrat. Hi, Alan.
Good morning. I'm glad you're taking my call. I've always considered the United States kind of a balance between capitalism and socialism, and I'm personally in favor of a single payer type of situation. And I get confused when people talk about health care. When I think of health care, I think of hospitals and doctors and nurses. Will your bill kind of keep those things in mind, or is this just a way to sell health insurance? Because health insurance is referred to as health care also.
I think, Greta, can I just go ahead and answer?
Yeah, absolutely, yeah.
Alan, I think it's a great point, first of all, that we commingle all of these terms. Healthcare is different than health insurance. Insurance is frankly, a very phenomenal mechanism by which we all pay a little bit, and if something happens to one of us, it's covered. Most people don't get very sick, but some do. Frankly, I've got a sick child. We've run up significant healthcare bills. I've been very fortunate to have access to good health insurance prior to coming to Congress and then now being on a government plan. But some people don't. And some people are getting subsidies directly from the government for their insurance. Some people work for corporations. Some people are on Medicare. Some people get health care through the VA. So we have a whole spectrum of way in which we get health care. What I'm talking about is a narrower segment of the population, particularly those in rural communities, who are in what's called the individual insurance market. Because they're a farmer or a rancher or other small business owner or just an individual, they aren't able to get the same rates that a big corporation gets, for instance, or that the government gets, because they're simply not in a pool or group with other people. So what my bill does is it takes a subsidy and helps people start up what we call risk pools so that they can share this risk, their costs can come down, and they're not unfairly treated by the marketplace. So that's the part of health care that I'm talking about, health insurance, and a broken part of the health insurance market. It is different than health care, but when you have people not having access to health insurance, they go bare and they aren't protected from something that catastrophic that could happen. And that leaves a lot of anxiety, particularly in farm country, but all throughout the country. So this is an attempt to fix one segment of the health insurance market that's severely broken, but it's inextricably intertwined with ensuring that people have adequate resources to protect themselves in the healthcare system.